My name is Pfeiffer. I'm a medical doctor, internal doctor here in Munich since about 27 years. And 18 years ago it happened that I, being a complete normal school medical doctor, and I met an American guy and he told me that he invented something that he called pulsed signal therapy, an electromagnetic field that betters osteoarthritis. Even we internal doctors know that there is nothing that let cartilage grow again. Nothing. Many people try to tell you stories about their drugs that betters your cartilage, but to tell you the truth, nothing does it. He told me that his electromagnetic field has the ability to better in over 80% the cartilage problems. That was so interesting for me that I went to the States and I was completely astonished what I saw, what I could talk to the patients, what they told me. And so I told him, I don't know how it works, but I can see that it works, and I start with that. So I was the first year in Europe to start with PST. In these days we have been only 2 in the whole world, one in Canada and me. And as a side effect, this starting changed my medical point of view completely. I do this now for 18 years, and for true, this field could change the osteoarthritis. It could better it really to 80%. We've done studies with the famous university, for instance with the Charité in Berlin, with the university in Milan and in Paris, and they all could show that under the influence of this electromagnetic field, the cartilage cells start to produce more proteoglycan, collagen, and so on. By finding that an electromagnetic field can do something which our chemical medicine cannot do, I started to think if we can't do more with this principle. And more than 8 years of studying, trying again, and so on, I invented a complete new electromagnetic field, which is now patent, and it goes against stress and all stress-related symptoms. To understand the importance of electromagnetic field in our human body, I have to tell you a little bit about the placebo effect. The placebo effect we all know. The placebo effect means that one patient I give some tablets with sugar and the other ones I give tablets with chemical ingredients. And they both, let's say, lower their blood pressure. The one with the chemical drugs a little bit more intensive, and the one with the sugar inside this tablet does it as well. And how does he do it? How? He do it with his brain. And the question is, how does the brain works? Electromagnetic. The only function in the brain, in the nerve systems of the brain, is an electromagnetic. The magnetic concentration is so low that since nearly 100 years we measure the electric part of the brain. That's why we can write an electroencephalogram. Same with the heart, we write an electrocardiogram. But there is still a magnetic component as well. So since 1977 we can write a magnetocardiogram. But back to the placebo effect. Because I can cure with the placebo nearly every illness. I can better the stomach, the knee, the depression, the blood pressure, name it. I can cure everything. That means the brain can produce organ-typical electromagnetic fields. Organ-typical electromagnetic fields. That's the way the placebo works. And that shows me the importance of the electromagnetic field in human beings. If we could mimic this placebo effect, or if we could produce it whenever I wanted, no doctor would be needed. Because this is where the miracle of betterness is situated. An electromagnetic field is a language, and this is of importance to understand why so many different electromagnetic fields in the market do different things. Our language consists of, I guess, 25 or 26 letters, and the combination of one letter gives the information. So with the same alphabet, I can speak English, German, French, Italian, Danish, Spanish, and so on. It's only the combination of the letters which changes the information. An electromagnetic field is the same, composed from different letters. And the letter of an electromagnetic field is how does it swing, as a sinus, as a staircase, and so on. How strong is it? How fast is it? Has it one signal to the next one? Is the time change? And so on and so on. Many, many different letters. And at the end, if you combine these letters good, you get a good cell information. If you combine them not so well, you get a not so good information. As a language. If I tell somebody in China somebody fell from the bicycle and hit his nose, it's an information, but not a very important one. The same with all these magnetic fields we have as treatments in our universe. They all do a little bit, but the thing is, don't mix the headline electromagnetic field with that what comes out, what kind of information this field carries. Okay, it took me more than 8 years to produce a complete new electromagnetic field, new, and that's why it is patent, which has the component like a staircase. First information as a basic, after a while the next information on top of this information, on top of the next, and so on, like a staircase. The idea was that this type of information is similar to our life. We create our knowledge, our habit, by understanding, by learning. So from one basic, we step to another, God created the world in 7 days. 7 days, not in 1 day. That means after the first creation, the next creation came and so on. That's why I used this staircase. The second thing is, our body is a very low energetic body. So we can't put a very strong energy into our body and hoping that this does anything. If I shout to somebody I want to inform, my information is not better. He normally does something, closes his ear or something, but he doesn't open his heart to my information when I shout. The same with an electromagnetic field. It needs to be low, pretty low. That's why my field goes from 0 to 100 micro Tesla. This is low because the Earth's magnetic field here in Europe is about 50 micro Tesla, 50. If you shave your beard in the morning with an electric shaver, it's about 500 micro Tesla. If you sit in a tube or tram, about 300 micro Tesla. And if you have a hairdryer close to your hair, the moment the machine is working, you are in a magnetic field of 1,200 microtesla. That means 100 is very low. And there are many letters I added, which are my secret. The next question for me was, my first therapy, the arthrotic therapy, was a therapy where I can treat only one joint after another. The knee, the elbow, the shoulder. I never could treat the whole body. The question was, is there something where I can put my electromagnetic field in to treat the whole body? In school medicine, if somebody has, let's say, a pneumonia, I don't put my injection needle into his lung. I put my drug into his blood vessels, knowing that the bloodstream takes the chemical drug and spread them all over the body, into the brain, into the eyes, into the toes, and into the lung, where the bacteria are as well. So I use this blood transport system to transport my chemical drug. Question is, do we have on an energetic level a transport system as well? Yes, we have. This is our so-called solar plexus. The old Chinese guys, they knew about. That's why my signal goes only into the solar plexus, which is a region around the umbilicus.
The navel. Navel.
Navel, yes. Umbilicus is a Latin word for it. So, and the third problem I had to solve was a so very low electromagnetic field. I thought the patient could have a problem because, let's say in this room, we have hundreds of TV spots, we have wireless LAN, we have GPS, and they all passes the concrete of my wall, and that passes me and the patient as well. Let's say 99% of these energies go through our body without any trace. But I don't believe that this is 100%. So let's say only 1% of these waves and energetic structures do something with me. They leave traces 100%. So the body always has to live with this what goes through him. And if I give a second or a third or 100 next information to him, he can't concentrate so well, I think. So if I would give my therapy in an area like this, it's like somebody gives a speech and 100 people are talking. The one who wants to listen can't concentrate so well. That's why my therapy is in a tent. In a tent made of a material that blocks 99% of the outside technical fields. That means if I close the curtain well and the patient is inside, there is energetic freedom. Nothing. 99% of the outside electromagnetic fields are blocked and the patient can concentrate completely on the field I offer. Offer is the right word because in energetic medicine my electromagnetic field always is an offer. Chemical drugs, you can't do anything. I give you 100 milligram of something, you have 100 milligram inside your body if you want it or not. So the moment you swallow down the tablet, you have 100 milligram inside. Energetic not. Energetic is an offer, and the patient himself decides if he takes 100% of that offer, 10%, or how many, how much. That means we have to create an atmosphere where the patient feels very homely, secure. That's why it's in a separate room, we close the door, I play a little bit of music that relaxes him. He should take off his cell phone and should shut it down, that he knows that nobody can disturb him, then he can rest, can lay down, and can take my offer to 100%.
Okay, so should we go and see the tent as you just explained?
Yes, I can show you the prototype, but we are just, in the moment we are designing much better design, but the signal stays. The signal is alright, the tent will become more nice, so I can show you the prototype right now.
Okay, so let's move to the other room then.
Yes. Okay, so this is the device that produces the signal I was talking about. We have everything here on a chip card, and in this prototype, on the chip there is a program, goes inside, and when I start, you see it counts from 0 until 58 minutes, then one session is finished. One session goes 58 minutes. The E-blocker material is this, with a lot of silver strings in it. And because it doesn't look so nice, we covered the bed where the patient lays. The wire from the steering device goes in here, and here is a coil where the electromagnetic field comes out. That means when you lay, it goes inside your solar plexus. You lay down here, relaxed. We put a blanket on your body so that you feel warm and well. Then we close the curtain, and we come back after 1 hour and wake you up.
Tingling, and I felt like bubbles, a bubbling sensation in the whole middle region of the
That's
body.
where it goes in.
Where it goes.
People often tell me that there's kind of murmur in the intestine.
Exactly. Yeah, absolutely. Good word for it. And then I felt like my temperature, my body temperature, was adjusting much better than it has been for a long time. That was within the first 5 to 10 minutes. Then I felt mostly in my legs and feet muscles relax. I have a tendency with my toes to turn my toes up, and difficulty bending my toes, and so the whole muscles of my calves and of my feet were relaxing so my toes could bend more. And then I generally just felt much calmer along the way.
Any part of pain?
No part of pain.
Okay. Because very often if somebody has a weak part somewhere, let's say in the vertebra,
Yes.
it starts to say, here I am.
Okay.
Just a little bit, yes?
No pain.
Okay, then your bones are very well.
Yes, I think so. But I was aware that it was sort of, those sensations were deepening along the way. And then in the middle bit, I think I slept for maybe 10 minutes, 15 minutes, something like that. Then I came back and felt very rested, very calm, and also very relaxed in the body.
Good. Okay.
It's a very nice sensation now. Yeah.
That's what I hear it's unbelievable, because normally you shouldn't say this, but there is no patient who said, I didn't like that. They all say, I like it, it was very nice.
Yes.
Some Arabic guys, they told me it was like flying a little bit in clouds, or flying a little bit on top of the mattress. But it was always a nice feeling.
Yes.
Never a bad one.
No.
Great.
So I'm very much looking forward to hear Jani's experience.
Okay. Now I showed you the prototype. We are at the moment beginning to produce a much better design type. So it's still a quader dice, kind of dice. The door, you can close the door, and we have here 3 layers of fabric. 3 layers of fabric. Outside, then comes the E-blocker fabric, and next fabric inside. It's like a McDonald's, yeah? the meat is the e-blocker fabric, so that every customer can tell us what he wants from outside color. If he likes green, he gets green. If he likes stars and stripes, we can produce stars and stripes as well, or whatsoever. Only the 7 of this year will stay. So then, patient lay down inside, and there is a computer, bit more sophisticated and more modern than the one I showed right now. What comes out is the same. The signal is good, but the design needs to be bettered. But the first question, of course, was, can I do something? What can I do with it? And now we design everything a little more modern and comfortable.
And for the production of these things, how much time do you think will it take?
The company that produces the tablet where all the technical things are in gives me the first type in beginning of June. That means in 4 weeks, and the new tent is in the same time ready. That means in about 1.5 months, 6 weeks we are ready.
Okay.
We're ready to go on.
Well, this is perfect timing then for people to find out about it. Great. I think what's really interesting for everybody is, what type of frequencies you're using for the creation of this language.
Frequency is only one letter, not the most important ones. The electromagnetic strengths, for instance, from 0 to 100 microtesla. This is one thing that is important. The way you give. I told already, I produce a staircase. You have signals on the market like a sinus. This for me is the worst, because I give, I take. I give, I take. It's like you feed somebody with a spoon into the mouth, out of the mouth, into the mouth, and you never get fat, yeah? You will always stay hungry.
You get the Pavlov effect then.
And the next thing, for instance, the PST signal is rectangular. Up for a special time, down. Different time to the next signal. More up, this is like a Morse code, yeah? Beep, 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 yeah? Like this. This is not bad because it works very well. But because it always goes down, it's always a new impulse. And I think for a cell, as in our life, it's much more important to get the next information of information before, so you can add one information to the other one. That's the way you get wise in life, yeah? And the cells, they like the same way.
Okay.
So the frequency is of importance, but not the biggest importance. Here I changed something, but this I keep as a little secret. There is a rhythm, a very special rhythm in the signal. There are two, A and B, and they are in a special rhythm. So that is, this rhythm is in special information as well.
Okay. And so, for instance, when you have a patient, we've seen earlier somebody who's experienced the treatments for his disease and whatever he's suffering from. Is there a difference in time or frequency that you apply it to, or is there a way that you prescribe it in a certain way for certain conditions?
So my claim of fame is stress and all stress-related illnesses. Stress is the problem of the 21st century.
Agree.
The World Health Organization said stress and everything that is related to stress is the biggest task we have to solve, the biggest problem we have to solve in this 21st century, and we don't have very good therapies. And especially, let's say, a manager who has no time and he is stressed. Tell him that he should go 2 times a week for Tai Chi, for Qigong or something like that. He will not do it. First of all, he doesn't have the time. Secondly, he's not used to this type of movement. Here, he only has to lay down.
Mm-hmm.
Something he's very used because he does it every night. Yeah, he doesn't have to learn anything. He doesn't even have to take off his clothes. He only has to come for 1 hour 4 times.
Mm-hmm.
So 4 times, 4 days, 1 hour is a good dose. But as in school medicine, not the ground dose is good for anybody.
Mm-hmm.
That means if somebody is very exhausted, maybe he needs 8, 10, 12 or something
Mm-hmm.
hours. This is, we have to find out. So
Mm-hmm.
I always start with 4 times 1 hour,
Mm-hmm.
and then let's see what the patient feels. If he said, it's good, I feel much better,
Mm-hmm.
then I leave him. Because it goes on by itself for at least 6 weeks. That's what I can prove by the studies. If he says, I feel better, but not as good as I hoped, then we continue. Until he tells me, now it's good.
Okay.
It's individual.
Individual.
But I would say 80% of the patients which are stressed needs only 4 hours.
Mm-hmm. So, in what I've heard you say before, there's no secondary effects. There's nothing that people come to you saying, after your treatment, I felt bad, or the experiences that you've had were through as many as you had it as patients, all positive.
Yes, which sounds very silly in medicine because you never have always and only good results, but it's true.
Mm-hmm.
There may be some. I treated now with the signal about 2,000 patients. Let's say a few, and it's less than 5 fingers, said I felt nothing or it didn't work. Of course, I have contraindications. Every therapy that is correct has contraindications. That means I don't treat patients with pacemakers, pumps or electric pumps that are implanted, insulin pumps or whatever. I don't treat pregnant women, as always in medicine, and I don't treat anybody with cancer. This only because I don't want to meet my patient in front of the judge, because I didn't do studies with cancer.
Mm-hmm.
So this is why, no, we don't treat this. There was
Mm-hmm.
nothing that happened or something. It's just a correctness.
Mm-hmm.
I don't want to be blamed, or I don't want to get into quarrel with my patient.
Mm-hmm.
Then, otherwise we have no contraindications.
Okay, so but if the person comes to you and doesn't tell you that he has cancer or doesn't even know himself, is there a way that you secure yourself by having to sign some kind of document before?
There have been a few, but only a few patients who knew that they have cancer,
Mm-hmm.
and they wanted to try. So I told them, okay, if you like, we can do, but please sign a paper that we do it as an experiment,
Mm-hmm.
and that explain to you that there is no knowledge about this. I'll help you as good as I can,
Mm-hmm.
but you have to set me free from any quarrels later.
Mm-hmm. So
That's
because
what they all did.
I think that a lot of people who are treated for cancer also undergo a tremendous amount of stress. So there is a belief system also behind it, that oh my God, I'm going to die, or I don't know if they can cure me. What if my condition is terminal, and so on. All of those thought patterns are spiraling and create a lot of tension and stress. So I believe that it would be, especially for such people,
Yes.
a very good treatment.
But the problem stays the moment he comes and said, you haven't cured only my stress, you put something into my cancer and he grew up, so how can I prove that this is not? So in several years maybe, when there have been studies done and so on, but at the moment this is a contraindication, except the patient really wants it and sets me free by signing.
Another question, because I think it's also important for people who are developing other devices, who are perhaps a good addition to what it is that you're doing. Would you feel that it is a good idea to visualize the body field before and after the treatment, and to basically have an image of what it is that changes between this 1 hour or the 4 types of 4 amounts of treatment that you administer, or that people will experience?
More than 15 years I did such type of pictures called kill-in photography, and with this osteoarthritis therapy I could show you very easily the changing of your energetic outcome before and after the therapy, and I could prove you that when you say, let's say, people are treated there 9 hours every day, 1 hour, 9 times in a row, and if you have this good outcome of energy picture before and after the treatment, let's say for 4 times, I can prove that this was an effective therapy, even though you don't feel anything. This energetic change is quicker than the material follow-up in the cell systems. When I see this change, I can tell you, your cells understood. They told me on the energetic way already, yes, I understood, and they start with the production of cartilage, even though there is not enough cartilage that you feel it. But on an energetic way, you can look a little bit into the future. Kill-in photography is old, and I guess nothing more is to learn out of it than what I did in 15 years. There's a Professor Eisele here in Munich from Fraunhofer Institute, and the moment we have the money, we too want to create a complete new device to picture this energetic change in humans before and after treatments or whatever.
And let's say, for instance, there have been studies made that light is very good for stress, the different types of light, and there's also many people who've exposed themselves to different sounds. Would you envision that there could be a combination of one and the other during this? 1 hour is a long time where you basically just relax and allow your field to change. I think what happens in, let's say, in the mind of a person is that when you see different light or different sounds, that there is something changing on a mental level just as much.
Better we don't mix too many things. 1 hour is not very long, because I think 95% of the patients fell asleep during the therapy.
Okay.
And I don't know, and I think nobody knows exactly what our cell systems think when we give an electromagnetic field, sound, light, one step after another. I think give them time to react of the first information, give them time to react to the second and to the third information, and not all combined. Then we have maybe something similar as we have right now, a mixture of electromagnetic fields in a room where our body is
which could lead to more stress than reducing it.
I don't know, but from my feeling, I would do one step after another. And for sure, this 1 hour sounds long, but nobody found that it's long. Normally people say when I pull up the scissors, is it finished? Is this 1 hour finished? And only a few said, oh, I'm happy that it's finished. This was a long hour, but this is a very rare case. You can ask the ladies as well. Very rare.
Okay. Right. So, anything else you would like to add? Because we still have plenty of time. If you would like to basically just talk about some special cases or something.
We are starting on a complete new type of medicine.
Mm-hmm.
Energy medicine is new, and we don't know much about it. So, when we start from the beginning, we have to be very careful and to prove what we are saying. There is so much strange things about energy therapies in the market because they just go on. Many, to tell you the truth, I believe many, they don't tell you, just want to sell to buy money, to earn money. But the aim should be to put into the world 100-year-old knowledge, which the physicians told us that the basic of material of this table, for instance, is energy. The basic of our universe is energy. The basic of our body is energy. Our school medicine knew this and put this into our technical parts. Due to this knowledge, we could develop MRI, CT scan, and so on. But what we now need is to put this physical knowledge in our point of view, how we look at the patient. Patient is not only a chemical institution. Mm-hmm. On his basic, he is energy. Mm-hmm. Chemical is follow-up.
Right.
And this we have to learn, to understand. We're just in the beginning.
Right, so that you...
Time is ready.
That you, let's say, create a new paradigm of medicine that allows us to not see the physical as physical, and but to basically see that everything is energy and that all of the body is consisting of those.
It's not that we should blame our school medicine. We've done perfect and wonderful things with it. Mm-hmm. We only have to go on. Mm-hmm. Science never stands still.
That's right.
And if somebody is forced to look to new horizons for his patients, these are the doctors. Mm-hmm. We should try to change point of views, to get to new and better therapies for our patient. It's our task.
Right. And for patients that find you, how do they find you? Because obviously many people who are out there stressed, they look for solutions, and sometimes they close themselves off because there's a latent depression going along with that condition. And how do they find you?
So at the moment, the patient come out of my office, mouse to mouse, via internet. There is a web page, www.impulse7.de, but it's in German. Mm-hmm. Up to now, later it will be in English as well. Mm-hmm. This is it, up to mouse at the moment.
Mouse to mouse.
I have not so many, but about 3 per week patients from Russia, only mouse to mouse, and they sit into the plane for 4.5 hours, only to come to go into my tent to feel better, and other things we do with them as well. Mm-hmm.
All right. So basically the understanding of the technology is there. There is so much potential to create multiple other devices. Mm-hmm. What do you see as a ideal future of medicine?
The ideal future of medicine is energy medicine. But slowly, we have to, it took several hundred years until our chemical medical medicine reached the point where it is right now. We had to learn about anatomics, bloodstream and blah blah and so on. And the same, we have to learn about energy medicine. We have to learn about the anatomics of our energy body. We have to learn how it is influenced by ourselves from outside. Many things. I believe one big step in human mankind was when we found out that when I wash my body, I could prevent illness. And the next step, I think, will be that when I wash out all the energies I got during the day, I live better and more healthy. I don't think that we will be able to take out all these technical fields out of our earth. I don't believe that. But we can create possibilities to wash out what we get on energies during the day. Let's say, like Impulse7, you put it into your bed. You lay on it, you fell asleep during the night, and you cover with a kind of e-blocker system, so you are protected from what is in your room, and you can wash out what you get during the day. It's something like this will happen in the future, when we understood what's surrounding us.
So that there is a specific mattress that comes with a specific type of cubicle bed combination.
Yes.
Sounds like a good idea. Okay. Do you have any particular message for our interested audiences? Try it, yes. And obviously to try it, they would have to take contact with you. Do you have
At the moment, yes.
Do you have an email address that they would then be able to contact you?
Knut, my name, K-N-U-T, point Pfeiffer, P-F-E-I-F-F-E-R, at t-online.de.
Okay. Do you also, let's say, create specific custom designs, or do you have, let's say, a possibility of, I don't know, if somebody really wants to include that in their own practice or whatever you have it?
Yes, just set up a little company, and we want to build up a selling company. There is, just today, came a guy who wants to sell Impulse7 in Denmark, Sweden, Norway. There are the first small steps to the USA, to Austria, Switzerland. So it's still a beginning, but we want to spread the therapy.
But there are different licenses that you can get. Okay, that was my question. Okay, so I think that everybody who's going to attend the seminar and listens to the information will be intrigued just as much as I am. Obviously, I've also experienced it myself, and I can honestly really say that it was very, very relaxing. I did feel that there was something happening in my body. Obviously, I'm not going to go into the detail of my condition, but the fact is, I encourage everybody who has some sort of arthritis problems, or even with other conditions that I'm now not allowed to specify because we're not treating with the seminar. Anything that you would like to know more about what specific types, I think you should take contact. Thank you very much, Dr. Pfeiffer, for taking the time.
Thank you very much.
Okay, bye-bye.